Right now, from KTAB News, your local election headquarters, this is Big Country Politics.
Thanks for being here. It's great to be with you. I'm Marley Capper. We start our broadcast with the latest from the state legislature. Texas lawmakers are back at it at the state capitol with the third special session of the Texas legislature this summer. Governor Greg Abbott has added several agenda items, but one of the biggest is redistricting tensions between Republicans and Democrats. And they're already running high after Democrats broke quorum to fight the election integrity bill. KTAB's Austin Bureau reporter Maggie Glenn tells us redistricting is always challenging.
Lawmakers gavel in Monday, this time with no worries of Democrats breaking quorum.
I'm glad the Democrats, at least more of them, have shown up to work this time.
This is a much more discreet special session, much more narrow call.
Even though relations aren't as strained as they were during the last two special sessions, redistricting adds tension even within party lines.
You can minimize the power of people's votes by either drawing them into very compact districts that only have people of a particular interest group.
We all know our neighborhoods that we represent. And if you're oversized, you want to give up the ones that you don't like as much. And if you're undersized, you want to pick up the ones that most likely would support you.
Redrawing new districts is meant to ensure every vote counts and no population is overlooked.
Texas District 140 lines were drawn to exclude my community from having any say in what flood mitigation funding efforts occur in neighboring Texas House District 141. A historically African district.
In the past, it's ended up in the courts and is expected to again after this session.
Our job as Democrats is to build a strong record.
Texas lawmakers no longer need pre-approval from the feds before adopting the new maps. That's because a 2013 Supreme Court decision removed the pre-clearance requirement of the Federal Voting Rights Act.
We don't have as much protection as we used to in the courts.
Republicans vow to draw the lines fairly and get it done in 30 days.
We'll make sure that every vote counts. And I'm feeling really good about the amount of preparation that's taken place is going to position us to get this done in just a few weeks.
In Austin, with coverage you can count on, Maggie Glenn, KTAB News.
Thank you, Maggie. Also up for debate, banning businesses from mandating the COVID vaccine and a bill that would require Texas students to play sports based on their biological sex rather than their sexual identity. Lots more action along with the Texas-Mexico border in Del Rio this week. The crisis on the border. Governor Greg Abbott flying in to outline what the state is doing about the influx of migrants because the federal government isn't. KTAB's Monica Madden explores all the new movement and why these migrants, mostly Haitians, are here in the first place.
This is total chaos.
Governor Abbott said roughly 8,600 Haitians are still waiting under a bridge in Del Rio as they hope to stay in the United States. Something the governor says is a failure at the federal level.
What the world is witnessing now is the open border policies that are being utilized by the Biden administration.
But the term open border is misleading. Under the Biden administration, U.S. Customs and Border Protection turned away more than 500,000 people from February to June at the southwest border. And those seeking asylum still need approval first.
We've been conveying that this is not the time to come.
Despite that messaging, immigration experts say the change in rhetoric from Presidents Trump to Biden has encouraged asylum seekers like the Haitians in Del Rio now.
There is some degree of a perception that it's easier to get into the U.S. Under the Biden administration.
Many Haitians are not coming to Texas out of the blue.
The rhetoric tends to portray the situation as really black and white when it's a really complex situation.
A series of natural disasters, the July assassination of Haiti's president, and increasing gang violence are all factors leaving Haitians feeling like America is the only option left.
Returning them to Haiti could be really dangerous.
While the federal government slowly processes asylum claims, Governor Abbott turns to short-term solutions, saying trooper vehicles have formed a barrier to stop people from crossing over the Del Rio Dam, for now, forcing them to stay in Mexico.
The federal government claims it has moved more than 6,000 Haitians and other migrants out from under that bridge, but thousands still remain. And now from KTAB, your local election headquarters. It's official. There's at least one hat in the ring for the race for Taylor County Judge. Taylor County Assistant District Attorney Phil Crowley filing paperwork to replace Downing Bowles, who is not running again. Along with being the Assistant DA, Crowley is also an adjunct professor of criminal law at Hardin-Simmons University. He says he would bring strong conservative leadership to the county.
I just want to bring my experience, which I believe is unique, and also my passion for delivering good government, and that's what made me want to run for Taylor County Judge.
Crowley is the first to officially enter the race. His name will be on the ballot in next year's Republican primary. And when we come back here on Big Country Politics, cases continue to rise when it comes to the COVID-19 in the Big Country, and an in-depth conversation with Annette Lerma, the Public Health Director. We're back in 2 minutes.
Big Country Politics on KTAB continues.
Thanks for staying with us here for Big Country Politics. Right now, we're with the Director of Public Health, Annette Lerma. You have been serving the community for over 20 years. Tell us what got you started.
Well, I answered an ad in the paper that was requesting a part-time nutritionist for the WIC program, and so I had just enough hours in nutrition where I thought that sounds interesting, and so I applied, went home from the interview and said I'll never get that job because that went terrible, and so a few days later they called and offered me the job, and here I am 20 years later, and that was actually September 11th, 2001.
Wow, so right up on 20 years. Did you ever think that you'd be at this point being the COVID czar of everything?
If you told the 27-year-old version of me that had just started where I would be in 20 years and that I would be responsible for leading a team during a worldwide pandemic, I would have absolutely pieced out. No.
Definitely. Well, let's go ahead and talk about COVID-19. Do you mind giving us an update of how the community is doing vaccine-wise?
Sure. So we reached 46% with eligible population being vaccinated. So it's taken us quite a long time to get there, but we are at 46%. That's the population that's 12 and older. Still well below what Texas is at. They're at a little over 60%, so falling behind that significantly still.
Right, better than we were a few months ago, though, when we were around 30%.
Better than where we were. Still have room to improve, though.
Definitely. How are the vaccines going for the kids who are 12 and older? Are parents being, more excited to get their kids vaccinated? How is the general feel for parents and getting their children?
We haven't had a lot of questions from parents for the kiddos. We've had a lot more questions for those just in the general population that are anxious for their third booster. And so I know there are some who are anxious to get their kids vaccinated. They've been nervous to send them back to school in, obviously around a lot more people. And we have seen a significant uptick in 0 to 19 infections, and so it is continuing to spread in that population. So I know that there will be definitely some parents who are relieved when it is available.
Definitely. I know that AISD is now offering a stipend for their teachers, I think of $1,000 if they get the shot by a certain date. Do you think that stipend will help encourage teachers and maybe make parents feel safer about their kids being in school without mask requirements?
Well, I'm sure it will encourage some who are kind of on the fence. But it probably will not encourage those that are pretty adamant that they won't get it. But I think that it will definitely help parents feel a little bit more, or maybe a little less anxiety to know that at least their teacher is vaccinated. All of those who can be vaccinated should be, and so I assume that it will bring a little bit more peace of mind to them.
Definitely. I know a lot of the cases for the Delta variant are targeting child-age students. Is the Public Health Department looking to do anything else to further target maybe parents who can get their kids vaccinated, or maybe extra precautions parents can take for their young ones?
Well, definitely once that is opened up to the pediatric population, we will be working hard to try to do on-site clinics. We'll meet people where they are, trying to focus on schools, where children are already gathered, places where they might be, whether it's the mall or some of the community events that we've tried to do in specific neighborhoods. And so we will definitely continue to do that and ramp that up, which is part of the reason why we need to hire more staff to make sure that we're prepared to serve the community and get those vaccinations out as quickly as possible.
Definitely, and I know that we have that health equity grant of about $400,000. How is that going so far, reaching out to communities of color and the LGBTQ plus IA groups?
So we haven't actually started on the activities of the grant. It still has to go through City Council for approval to accept the monies and for those to be allocated. And so we will do that on Thursday, and it will go through the first reading, and then I think it has to go through a second reading on October the 12th, I believe, 10th or 12th, 14th maybe. And so once that part is complete, then we can start the activities for the grant. The contract can be considered fully executed, and then we can start on the activities of the grant. But right now, what we're doing is just working on hiring staff.
So let's go ahead and dive in. There is a lot of positions open, some that are newer. Do you mind kind of talking to us about what those positions look like and maybe some of them?
Sure. So we have some nursing, some clinical staff that we're needing. That's pretty obvious. We need additional people to go out on site to be able to keep staff here, to continue to do vaccinations here, but also to send additional people out into the community. So we have a training specialist that we are looking to hire. This is really important as we get into health equity. It's going to be important to educate the staff that will be going out into the communities. And so we hope to hire a training specialist specifically for that. We are looking for a public health emergency preparedness person, and this person will help us to kind of do some strategic planning in terms of how do we prepare for the next pandemic. What did we not have previously that we feel like we need to have? And so looking at maybe some of those gaps in our own preparedness and as well as preparedness for the community. With all of this extra money that the state and the feds are sending down, it requires somebody else to manage that. And so we're looking for a grant manager that can take on that in terms of managing the money portion, but also the reporting that comes along with all of these grants that we're getting. Case investigators, we need data analysts, which we did just replace our data analysts that left, but we're looking to bring on an additional one because we need a backup. We need to make sure that we've got a couple of people trained in this software that is very specific. It's not something that I can take over or that another staff member can just easily step in, and that's a really hard position to cross-train in. And so we want to duplicate efforts and have some backups in case and just so people can take vacations. We've got staff that has not taken a real vacation in 21 months. At that rate, we're going to have people burn out. And so we're working really hard to continue to spread the work out a little bit further and further so we don't push our own staff to their limits.
Definitely. Well, thank you so much, Annette. When we return, we'll continue our conversation.
Big Country Politics on KTAB continues.
Thanks for staying with us. We're still with Annette Lerma, Director of Public Health. Annette, go ahead and start by talking to us. It's flu season's coming up. The holidays are coming up. We just had the Texas West Fair and Rodeo. What are your predictions for kind of this spike season?
Yeah, I think it's making everyone, at least health officials across the nation, very nervous. We have seen a little bit of leveling off as far as hospitalizations in Texas. I know the governor has put some things out recently in the past week or so about encouraging trends in hospitalizations, and they seem to be on the decline. We've seen a slight leveling off here in Taylor County. Although it tends to yo-yo back and forth, I think we need at least a week or two under our belt before we really say whether or not this is a true trend on the downward slope. So we're hopeful, but as you said, we're coming up on the holiday season with flu getting an early start this year. We don't officially start tracking flu activity until October the 1st, but we have had many reports saying that they are seeing a lot more flu in doctors' offices. And so we are nervous about what that means for our hospital system. If we don't bring hospitalizations down quickly with COVID and we start adding flu hospitalizations on top of that, we may once again be in real trouble. And so it is very important for people this year to get their flu shots. Last year we enjoyed a really mild flu season, and I think the fact that we weren't gathering as much, everybody was masking consistently for the most part, and being really diligent about hand washing and all of those things, I think that really highlighted how much we are able to control flu if we put our minds to it. And so continuing to do those things that you can. If you feel sick at all, please stay home. We've already had several staff members here in our own organization with flu. And so we will start administering flu shots fairly soon. But you can certainly ask your doctor about when you should get your flu shot. I highly recommend that you get your flu shot this year. We're anticipating a much busier flu season.
Definitely. What can children expect? Obviously, flu coming into the school districts, parents, is the message not only getting your children and yourselves vaccinated for COVID, but also flu vaccines?
Yes. So again, just parents making sure that their kiddos get it, they get it for themselves. Definitely if you're high risk, if you have underlying health conditions, the same thing applies to you that it did with COVID. It's really important for you to protect yourself. To make sure that you're, not spreading it around, but just something as simple as washing your hands. I know every single time we come in from going to the grocery store or being out in public, or I've tried to train my child as soon as he gets home from school, wash your hands. Before you eat, wash your hands. There is good research that says something as simple as washing your hands can reduce the spread of flu significantly within school settings, and especially for those younger kiddos. So wash hands.
Definitely wash your hands. How would you say that the healthcare people in the community are feeling? How is the morale?
Well, I think that I'm sure in the healthcare setting and here in public health, people are exhausted. I mentioned that there are some staff that have not taken a real vacation in almost 2 years now. And it's disheartening when in the healthcare world that there is a way to prevent this, and there's so much misinformation and, people choosing to side with a political party or having this be a political issue is unfortunate, and it's just very frustrating to know in the healthcare setting that they are taking care of people that didn't have to be there. And so I know morale is waning, but everybody keeps plugging along. We've had to continue to work in an environment that is not ideal. And nobody would choose it, obviously, but these are professionals. They're doing what they were trained to do, but they are also human, and I'm sure it is exhausting.
Definitely. I know you mentioned hospitalization rates. Do you mind kind of walking us through what those demographics are looking like right now, especially if the hospitals are already overloaded before flu season?
Sure. So hospitalizations, like I said, we've seen a slight leveling off here. The average age of hospitalization has fluctuated quite a bit. We have been seeing some average age of hospitalization as low as 54. Right now, I think it's about 64. 75 to 80% of those that are in the hospital are unvaccinated, and that has been consistent. So, for example, today we had 97 hospitalizations in Abilene. That's just Abilene. 48 of those were Taylor County residents, but 75% of those are unvaccinated. We have only had confirmed report of deaths in 2 vaccinated individuals, and those were elderly patients. And so we are not seeing the vaccinated pass away from COVID. So it is definitely protecting those from serious illness and death.
So the public health district, sorry, I didn't mean to interrupt. The public health district and Hendrick Health have really partnered together for this infusion clinic. It's had a lot of success. Less than 1% of the people who have gotten the infusion have had to be hospitalized. But it might be a little tougher now to get those infusions for the most at-risk people. Do you mind walking us through that?
Right. So if you'll remember back as we started this surge, they really made a big push to try to curb some of the hospitalizations with the monoclonal antibody infusions. So we did the same thing. We ramped up quickly. We've been able to almost quadruple the number of patients that were being able to be treated locally per day. So I think they had been seeing, Hendrick alone had been seeing about 12 patients a day. And I think we had gotten up to somewhere around 48 patients per day to be able to be treated. But now the problem is supply. So supply and demand. I don't think that the manufacturers have been able to keep up with the demand nationwide. And so the feds said, well, we need to, previously providers could just order it directly from their suppliers the way they would normally order medications. But because of the shortage, the states are now having to ration it out. So all of the orders must go through the state. And so, you know, we've been able to see as many as we needed to up to this point. But now with the short supply, the infectious disease doctor is really having to prioritize those that are at the highest risk. And so people being able to go in and just refer themselves because they think they might qualify on the self-referral form. You know, it's the best way to get in is to go and see your physician first, so that physician can refer you and make sure that they communicate that need to the doctor that is reviewing those.
Well, thank you so much, Annette, and thank you for your service. 20 years to this community. We're very grateful for you. We'll be back in 2 minutes.
Thank you.
Big Country Politics on KTAB continues.
Well, that does it for this week's edition of Big Country Politics. For the latest political headlines, always go to bigcountryhomepage.com. Thanks for watching. We'll see you next week. Same time, same place. Thanks for watching.